Welcome to Coronavirus The Rundown. I'm Usher Qureshi. Each day we showcase how communities are taking on coronavirus. We also break down the big headlines. A health alert from the CDC about the mysterious and serious condition in kids linked to coronavirus. It's called multisystem inflammatory syndrome in children, or MIS-C. There are confirmed cases in at least 19 states plus D.C. The CDC now has guidance on how to diagnose this condition. Kids must have a fever, evidence of inflammation in the body, and issues with at least 2 organs, along with evidence of coronavirus. Well, April was a historically low month for retail. The Commerce Department reports a record 16.4% drop in sales last month. Every category fell except online sales. Economists say declining retail sales are a key reason the economy is shrinking. Well, some breweries are being forced to dump their beer down the drain because of the impact of coronavirus that it's had on sales. Alexa Liaco looks at the unique struggle these businesses face.
It's really depressing to not have anybody in the seats.
Named as a place for community, Comrade Brewing is one of many breweries stuck in a bitter reality.
We're just in full-on survival mode now.
Brewery owner David Lynn says that strain weighs more heavily each passing day.
It's really heartbreaking to have to, cut hours or furlough people. We don't even run the heat anymore. That's why it's so cold in here. Just, trying to find anything that we can do to save money.
A skeleton crew now runs the deserted brewery, a stark contrast to a few months ago.
We were having the best February that we have ever had, and then, March was still looking pretty good until this shelter in place, and it kind of just killed us right there.
So they changed their business strategy, canning to-go beers for customers trickling in.
So there was a giant rush and huge demand for crowler cans and glassware. In normal times, we would order a pallet of the cans, and they would show up in about 2 days. Last time it took 17 days.
On top of the rush to become a takeout shop, Lynn was forced to throw some of his business down the drain.
Unfortunately, some percentage of that beer may go out of code and need to be destroyed.
Lynn sold kegs of beer to restaurants nearby. Now that those restaurants are closed or barely operating, the beer has gone stale.
There'll probably be about 4 dozen kegs that we'll have to dump to kind of just see it get old and get it dumped down the drain. It's like a real tragedy for all of us.
Even worse, breweries like Lynn's don't fit the mold for government loan programs.
These loans weren't designed for hospitality businesses. They weren't designed for people who had to close and have their revenue be down. It's designed to keep workers on, but that's a real challenge if those workers have nothing to do.
But despite the sour taste left in Lynn's mouth, this first-generation entrepreneur says other brewers have reached out, offering supplies and plans to collaborate on brews of hand sanitizer, a camaraderie he's thankful to tap into.
We just have to really kind of band together and help each other out through these difficult times.
Because together, this once-booming industry can look at its future, pint half full. In Denver, I'm Alexa Liaco reporting.
The FDA says it's investigating reports that a rapid coronavirus test is producing inaccurate results. It says it's gotten at least 15 reports of false negatives from the Abbott Laboratories ID Now test. It's the test the White House uses. The FDA says it's now advising the White House to have negative test results confirmed by a second test. Abbott is standing by its product. And the head of the FDA says the agency still recommends using it. Employers are crafting plans to keep their workplaces safe when people come back. For now, most companies say they plan to use face masks, social distancing, and pre-shift screening. A small number plan to use antibody tests to determine which employees are allowed to come back. That number has been shrinking amid doubt about how accurate antibody tests are. HR experts say companies that decide to require antibody tests should be clear about the process and have a plan.
They want to make sure that when they do testing that they're consistent and that they're not just selecting people. For example, selecting only older workers or selecting people who they believe have underlying medical conditions or selecting those who are pregnant to do the testing. Anyone who's coming into the workplace should actually be getting that test done if that's going to be a requirement of the employer.
Amber Clayton is director of the Society for Human Resource Management's Knowledge Center. She says relying on antibody tests could cause a delay in getting people back to work. Clayton also says current laws to protect workers don't cover antibody tests, but
has tested positive for COVID previously, and they decide to bring that person back to work and not somebody who wasn't, they could be discriminating based on medical conditions.
She says employers are allowed to do things like temperature checks and health screenings under the Americans with Disabilities Act. For people whose employers do require the antibody test, Clayton says communication is key.
If they have concerns about getting any types of tests or they feel that they can't get the test, talk to the employer, and the employer may be able to come up with a reasonable accommodation.
Clayton also says employers are sometimes required to pay employees for the time spent on required testing and screening. Across the country, people tested for COVID-19 are ending up with unexpected medical bills. Chris Conti takes a closer look at why some say insurance companies aren't doing what's right.
Long before an epidemic swept across the globe, Anna Davis-Abell was already spending her days trying not to get sick. She is 25 years old and has been living with lupus for most of her life.
The way that everyone feels right now is like the way that it always feels to live with a chronic illness.
It was early March after returning home from a trip that Anna started feeling sick. Even after taking a terrifying trip to the doctors, Anna was told there were no tests in the state of West Virginia where she lives. And then the symptoms got worse.
I was going from being super sweaty to like really cold. I developed a cough probably on like the third or fourth day.
Initially, she was diagnosed with the flu. When that didn't get better, she was eventually given a COVID test, a test that under federal guidelines was supposed to be covered by her insurance company. Imagine her surprise when a bill for $536.46 showed up in the mail.
Well, I think it shows, unfortunately, that at the end of the day, it's a healthcare industry that's not first about health.
So what's happening here? The CARES Act mandates that insurance companies cover COVID-19 tests, but many Americans are finding out there are loopholes. Sometimes insurance companies bill them incorrectly, or in Anna's case, she got a test before the law went into effect.
Most people, when they get a medical bill, they're frustrated, they're angry, but they don't really know anything that they can do about it. And I feel like that's what the insurance companies are really relying on.
The COVID-19 billing and medical debt is going to be a nightmare.
Craig Antico is the founder of RIP Medical Debt. His concern is that many of us will just assume COVID tests are covered and then months later find bills in the mailbox.
People aren't going to start feeling the pressure of paying these bills until almost a year from now.
As for Anna, after she called her insurance company multiple times, they forgave the charges.
As the discourse moves past the initial fears that we had, there's going to be less pressure on the insurance companies to be held accountable.
Accountability so that patients aren't suffering any more than they already are. I'm Chris Conti reporting.
More people are seeing pests in their homes right now. We asked the experts why and how to keep them out. And there are now robots that clean offices. We'll show you how they work and ask when they might be coming to our homes.
You're just a bug, only at Hardee's.
Cleaning robots are now inside many businesses. Amanda Brandeis shows us how they work and when they might be available for your house.
Some of the places most familiar to us now feel foreign, like empty airports or the sight of customers wearing masks inside grocery stores.
Shoppers will demand cleanliness, demand hygiene, demand sanitation.
Eugene Ezhikevich says in the past, cleanliness was about aesthetics. Now it's about safety. He realized a long time ago that some of the most mundane cleaning jobs were the most critical.
We wanted to focus on robots that do a task, do something boring, but something useful.
So they turned machines that used to need a driver into fully autonomous vehicles. Equipped with artificial intelligence, they operate like a self-driving car.
Right now, those are the most needed robots. Robots that clean, and disinfect.
BrainCore robots were already in stores like Walmart and Kroger before the pandemic. Now demand has spiked as businesses adjust to the new sanitary norms. The robots can clean stores with precision while allowing employees to focus on other critical jobs. Their autonomous floor scrubbers deployed across the country are doing 8,000 hours of work a day.
Robots don't cut corners. They don't have bad days. They don't get viruses.
Other businesses are turning to germ-zapping robots without brushes or mops. Commonly used in hospital operating rooms, the Xenix robot uses pulsed ultraviolet light to disinfect.
Retail environments, malls, airports want to deploy the same technology.
These businesses are also considering electrostatic sprayers, which mist disinfectant across wide areas. Ezhikevich says this too could be done by a robot. But AI cleaning robots to disinfect your whole home, experts say, are several years away.
This is absolutely going to be the future.
Robots allowing us to worry less about cleaning and focus more on what matters. In San Diego, I'm Amanda Brandeis reporting.
We're seeing some strange side effects from having to stay at home. It turns out pests want to join us in quarantine. The National Pest Management Association has noticed more pest control calls for homes lately. Entomologists say insects and pests know how to live alongside humans. So if we change our behavior, they change theirs too. Much of it has to do with us being at home more and cooking more and ordering more takeout. At the end of the day, we're creating a lot of food odors that end up in the trash. And now with fewer people dining out, restaurants are creating less garbage.
It takes away a food source from pests like rats, for instance, causing them to change their behaviors in search of food.
We're also seeing warmer temperatures. As it gets hotter, pests become more active, especially cockroaches and ticks. The first thing we should do if we're seeing this problem in our home is to identify possible entry points.
Trick that I like to use is to go into the garage, turn off the lights. This is during the daytime. And any light that I can see leaking in underneath the door or the garage door through the seal, that's an area that I have to think about sealing up.
Whenever you take out the trash, make sure any food odors are properly contained and the container is sealed. Something else you may not have thought of, delivery packages. Cockroaches love cardboard and may be hitching a ride on boxes that end up on the doorstep. Make sure to inspect packages before bringing them in. And last but not least, if you are seeing a major pest problem in your home, take note that you likely won't be able to handle this with a DIY project. It's best to contact a professional. Well, childcare is complicated right now, and advocates say it's impossible to reopen the country without it. Bo Evans reports on the call for more funding.
Groups of children playing together, screaming, knocking over toys, isn't a sight many of us have seen in a few months. But some child care centers like the YMCA have been offering emergency child care to essential workers during the entire coronavirus crisis.
Child care is essential.
Chris Coker runs the YMCA of Northern Colorado and said the staff came to work before knowing where all of its funding was going to come from.
Well, the world got shut down on a Thursday, as I recall. Monday, we're open for essential child care, the Y is. And it was a very rapid response, whereas some of the other providers, it took them 3 weeks to figure it out.
While the Y's instincts have allowed essential workers like doctors, nurses, bus drivers, and grocery store employees to keep going to work, eventually that bill will come due. And it's pretty expensive.
It will cost at least $9.6 billion in new funding to sustain the sector for each month that the pandemic carries on.
Stephanie Schmidt works for the Center for Law and Social Policy. According to its analysis, the country will need $50 billion for child care services to make it through the pandemic. In the CARES Act, only $3.5 billion was allocated for child care relief. Schmidt says that won't last very long.
To put the $3.5 billion into context, we estimate that $3.5 billion would actually only last about 2 weeks.
Money for child care from the government is sent out in block grants to the states, then distributed by each state to facilities like the YMCA of Northern Colorado and used to lower their costs to parents. Additionally, money would help offset increased costs due to the pandemic, like increased safety measures, back funding for organizations that have stayed open for emergency childcare, and relief for parents who've had to keep paying organizations to hold their child's spot in existing facilities. The argument is for any meaningful reopening of the country, childcare will be essential.
People lived because there were the doctors, nurses, police, fire, energy, boom, 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 boom. And they could do that because we could take care of their kids.
I'm Bo Evans reporting.
Senators Elizabeth Warren and Tina Smith recently released a plan to make that $50 billion proposal work. Well, we aren't the only ones feeling the effects of isolation. It's hitting pets, too.
When they shut everything down and we couldn't have his guests coming in, I was sitting with my daughter-in-law and I said, Soda seems really sad.
How that boxer named Soda is now getting a boost and helping business with a unique kind of no-contact delivery.
Donation or volunteer today.
No contact and touchless delivery are phrases we've all become familiar with. One shop, though, is taking that delivery trend to the dogs, literally. Here's Maya Rodriguez.
Stonehouse Urban Winery, this is Lori. May I help you?
At the Stonehouse Urban Winery.
All right, Jeff, I'll get it out there.
Wines may be the main attraction.
You're such a pretty boy.
But it's soda. That's the star.
People will usually say hello to him before they say anything to us.
Meet Soda, an 11-year-old boxer who is a mainstay at this Hagerstown, Maryland winery. He's a real people's pup. Loriata is his owner.
He's a happy dog. So when they shut everything down and we couldn't have his guests coming in, I was sitting with my daughter-in-law and I said, Soda seems really sad.
So they came up with an idea. If people couldn't come to Soda, then Soda would go to the people with his specially made vest and minimal training.
Where I just open the door and off he goes. Okay.
A new form of wine delivery was born.
Luckily, the very first customer was one of our regulars. She loves soda. And she was at the top of the walk. He did whack the door frame a little bit with the bottles. We've taken care of that.
He's becoming quite the celebrity.
Soda's sweet face is now drawing customers from as far away as Virginia and Pennsylvania, who now have the option of coming in for pickup or having Soda bring out their wine.
When she was like, do you want to do it? I was like, yeah, I'll do it. He's so cute.
Soda.
Occasionally, he can get distracted.
And he spun around to see what was making the noise, and she kind of had to chase her wine down a little bit.
For top-notch service, customers can reward him with a tip, courtesy of dog treats located inside his vest.
They love to work. That's what boxers were bred for.
Soda won't work forever, though.
He's a very healthy 11-year-old, but, we all get old. So maybe I'll get another pup in training.
In the meantime,
it makes people smile. Good job.
Everyone stopping by for wine gets to enjoy a bit of soda, too. In Hagerstown, Maryland, I'm Maya Rodriguez reporting.
A creative way to show frontline workers some love. The hero pouches one woman created.
Keller & Keller. Right now.
We like to end the rundown with stories that remind us of the good going on around us. Today, a woman from Michigan who's making hero pouches for frontline workers.
So each of the pouches contains a package of tissues because, of course, with Michigan weather, it's always changing and, blowing nose. But really, the tissues actually each have an inspirational message on them, which we loved. And then there is a granola bar because, of course, they're probably going and barely get to stop to have a snack or a lunch. So that's a quick, bite that they can have.
Terry says there are also other surprises to make employees feel loved. Well, that's all the time we have today for Coronavirus, The Rundown. We'll see you next time. I'm Usher Qureshi. Thanks for joining us.